Right. So if you have read and understood, considering the clinical examination station, kindly begin.
I'll enter the room. I'll wash my hands and I'll introduce myself. Hello, I'm Dr. Karma, one of the exam candidates. May I confirm your name and age, please?
I'm Tony, 19 years old.
Nice to meet you, Tony. So today I've been asked to examine your ankle and the legs. That will involve looking, feeling, and moving. Are you okay with this?
Yes.
So Tony, do you have pain at the moment in your ankle or leg?
Yes.
Yes. Oh, I'm so sorry. Do I offer you painkillers?
No, that's all
Any
right.
pain?
Continue.
Okay, we can continue with the examination then.
Yes.
Okay. So I'll see for any walking aids and
Again, you
so
forgot
Tony can
exposure.
exposure. I'll expose the knee and downwards
Yes. Need to.
and the knee and below, and
Yes.
then I'll I'll begin with the look. I'll ask him to stand. Can you stand for me? And then Tony, I know you have pain, but can you walk few steps for me towards the wall? But I'll help you. I'll help you if you have severe pain. Okay. So if you can, then can you walk on your toes and then on your heels? Then I'll ask him to sit. Thank you, Tony. I'll inspect for any scar mark, deformities, any swelling, wasting. During the gait, I'll see whether there's any form of antalgic gait or not. Now, Tony, I'm going to feel your leg and ankle. I hope I can continue the examination. I know you have pain, but I'll be very gentle. And if you feel severe pain, do stop me. And then I'll feel for temperature with the dorsum of my hand on the foot, and then on the ankle and the shin. Then I'll feel for tenderness. I'll do the squeeze this on the metatarsal heads. I'll palpate the tarsal bones. Then I'll feel the calcaneum, then the medial and lateral malleolus. I'll feel the tendo Achilles, then I'll feel the shin of the tibia. Now, and then I'll also feel the pulses, the artery dorsalis pedis and the posterior tibial arteries. Now, Tom, I need you to do some movements for me. As but if it is very painful, then you can just tell me. I'll stop it. And I'll do the active movements and ask him to. Can you move your foot towards your head? Then can you move it down as if you're pressing a pedal? Then can you turn your foot as if the sole faces each other, and then now outside the sole facing against each other? I'll do the then now, Tony, I'm going to move your ankle myself. Just keep it relaxed. I'll do the passive movement to the plantar flexion, dorsiflexion, inversion, and eversion. Now, Tony, I'll do some certain special test for your ankle. So just keep it relaxed. If it is painful, like I said in the beginning, do stop me. I'll be very gentle. And then I'll do the talar tilt test with the valgus and varus stress. For the varus stress, I'll do in 3 positions: the plantar one in plantar flexion, one in dorsiflexion, one in the neutral position. I'll hold the lower part of the leg with one hand. The other hand, I'll cup the sole of the foot, so the heel of the foot. Then I'll do inversion, and then I'll do the stress test, and then same on the eversion with the valgus test to test see the deltoid ligament. Now I'll do the anterior draw test, whereby I'll keep the ankle in plantar flexion, 10-degree plantar flexion, and then I'll fix the lower leg with one hand, then cup with the other hand on the heel, then pull anteriorly, see whether there's any abnormal laxity. Now, Tony, I need to examine the back of your leg. Can you kneel on the chair, please, and hanging your leg over the chair? Do you have a pain in your calf at the moment? Okay, I will press the calf muscle to see whether the tender Achilles is intact or not. So that is the Simon's test. So thank you, Tony. I've completed my examination. Thank you for your time. So to complete my examination, I will do a complete neurovascular examination of both the lower limbs. So today I've examined a 19 years old basketball player who came to A&E with sudden severe pain on his right ankle. On examination, I found that he has an antalgic gait, and there was swelling on the right ankle with tenderness over the lateral aspect of the ankle. And I found that both the active and the passive movement range of movement was decreased due to pain, and the talar tilt test was positive in neutral position, and the anterior draw test was negative. The tender Achilles was intact, that was confirmed by the Simon test.
Good.
And
so what are your differential diagnosis?
From the examination, I would like to keep my provisional diagnosis as ankle sprain with injury to the calcaneofibular ligament. I will also consider the fracture of. I will also need to rule out fracture of the lateral malleolus, and also fracture of the base of fifth metatarsal, and cuneiform uncomploid or compound fracture.
Yes.
So for investigation,
how would you confirm your diagnosis?
I would like to do the X-ray of the ankle in the AP lateral view and the Motis view, and also like to rule out soft tissue injury. I would like to do MRI of the ankle. For the treatment purpose, I would like to go for conservative management initially, giving him the RICE therapy, the rest, ice therapy, compression, and the elevation of the foot. And then if there is any associated fracture, then I'll treat accordingly, ma'am.
Okay, so if there is like you asked for the X-ray, and the X-ray showed undisplaced fracture of the fibula with ankle swelling, how would you manage the patient then?
It will depend on what kind of fracture it is, whether it's Weber A, B, C, ma'am. If it is A and B and undisplaced, then I'll go for initially I'll go for a short leg back slap.
Yes.
Splinter leg, and then if it is Weber C and unstable, then I will go for operative management, ma'am.
Okay, right. So in the beginning, when you started with the inspection, you were looking for the aid, walking aid, and you asked for the gait of the patient. Yes. What were other things that you were supposed to inspect but you missed because I interrupted you and asked you about the exposure?
The deformities and swelling and all, ma'am?
Yes. Deformities and swellings and wastings and scars and anything that you might find over there. Okay, so that you missed, right? And then once you were like explaining the procedure, you didn't mention what would be the position of the patient. Would the patient be standing while you're examining, or would the patient be sitting?
Patient
would be
sitting, ma'am.
Yes, right. And yes, and then you told very nicely the tenderness and the squeeze test and the temperature pulses. You explained very nicely the active and passive movements and the special test that you'll perform. Even the explanation or description of your summary was adequate. It was good. Did you mention that you'll exam the knee, you'll do the knee examination if time would have allowed you, and full neurovascular examination of both lower limbs, right? I think you did.
I missed the knee, but I mentioned the neurovascular examination.
Okay. You have to remember this as
Yes.
a rule.
Yes.
Whenever you're examining a joint, joint above and joint below, always.
Yes.
You
ma'am.
have to
Yes.
include. So yes. Right. The rest of the things you told me, yeah, that's okay. Good. Thank you.
Thank you, ma'am.
Small room of improvement is always there, but it's good. Starting